super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back and talking about a lot of interesting topics that may affect you and your loved ones and your neighbors, and might get your MD degree after 4 years here, so you're well on your way. I think you're a sophomore now in the medical school, the Lederman Radiosurgery Medical School. We had a woman who came in with fallopian tube cancer. Now, she came in earlier in the year, and you maybe remember me talking about her. She was diagnosed with fallopian tube cancer, the tube between the ovary and the uterus, where a little egg pops out and travels down to the uterus to meet its father's sperm and make a baby or whatever. Anyway, this woman developed a cancer of the fallopian tube. And you may say, wow, I didn't know it could happen. And most parts of the body can develop into cancers, unfortunately, sadly. Anyway, she was diagnosed about 5 years ago, and she had 5 years of 18 different kinds of chemo. She had radiation, she had surgery, standard radiation, surgery, 18 different kinds of chemo over 5 years. None worked. The cancer kept growing. They would just put on new chemo and try it, and she'd get sick and neuropathy and try it and counts and neuropathy and not work. And can you imagine that for 5 years? 5 years of torture, chemo that doesn't work, radiation, surgery doesn't work, a big mess. She came to us. She was fed up with that big place. She came to us. We looked at her case. She'd even had radiation in the pelvis before. A lot of people say, oh, if you've had radiation, you can't have more. Well, that's not really true, and we probably have the world's largest experience of re-irradiation. So she originally had 2 balls of cancer in the pelvis, and they kept growing until they turned into like a big basketball. We treated her. Her cancer marker, by the way, and many cancer patients have markers, and it helps a cancer patient to know what the marker is, because you can say what my marker is, and if it's going up, it's usually a bad sign, and if it's going down, it's usually a good sign. That's not always the case, but usually. Anyway, her cancer marker, CA125, which is a marker for gynecologic cancers, ovarian cancer in particular, was 5,500. Wow, 5,500, with a big mass in her pelvis where she'd been operated on and radiation before. We took her on. She had 5 treatments. We made a stereotactic frame. It was custom made for her for this gynecologic cancer. She had 5 treatments. Each treatment's about 15 minutes. She came either from home or from work. She works even now. She's 70 years old. Had 5 treatments. She first got a repeat cancer marker. It was 5,500 before treatment. The first marker before anything else, after 5 treatments, before anything else, showed it had fallen to 50. So to go from 5,500 to 50, well, to go down by 10% would have been down to 5,000. To go by 90% would have been to 500. Went down to 50. It went down by 99%. 99% reduction in her marker. She came in at that point and she was happy. Then we got a repeat PET scan, and the cancer shrank by that much as well on physical, and it didn't spread anywhere else. It just shrank with those 5 treatments. No side effects. She continues to work and travel. She just came back from a big Mediterranean cruise. She looks great. She's feeling great. She's happy. She wants to be the poster child, and let's talk about it in 20 years. But right now, she is doing fantastically. No side effects, well tolerated, and an excellent response from radiosurgery from what was thought to be an incurable, recurrent pelvic cancer. And speaking of which, another man, similar situation, not exactly, but similar, a man with lung cancer. He came from one of the big hospitals. Now, he had cancer in the mediastinum, multiple nodes, multiple lymph nodes were involved with cancer in the chest, and all the way up into the right neck. He had a big mass, like a big, a big tomato in his neck. And he was getting chemo, and he heard about us, and he wanted to give us a shot. And his doctors didn't like it, and he's a pretty strong man and logical man. He said, look, I want my best chance for myself. And so he signed on. We gave him 5 treatments to the chest, 5 treatments to the neck, and the big neck mass, he could feel himself go away. When he was getting a chemo, nothing was happening. When he got the 5 radiosurgery to the neck, it went away. So he knew something good was happening. This is back last winter. Now, he got a new PET scan recently, and his doctor's there. He's still seeing his doctor's there, which is perfectly fine. We can work with anybody. If you, the patient, you, the President of the United States of your body, want that, that's great. And his doctors on the PET scan said, well, it's all messed up. And he came to me and he said, my doctors over there told me it's all messed up. And I looked at the report. I looked at the scans. I got a second reading on the scans even. And what was messed up was what we treated went away. And what they treated with the chemo, there shouldn't have been any more cancer, but in the right lower lung, there's a new 4-centimeter mass. That's away from what we treated, so it means that the chemo that he was getting didn't work, but it meant that the radiosurgery that he got worked perfectly. So it was almost like a randomized experiment. We treated this, and they treated this and that, and our lymph nodes, big lymph nodes in the chest and the neck, went away. What they treated, which should have been that and the rest of the body, well, what we treated went away. What they treated, it came back. So he's smart, as I said. He's logical, and he's decided to come with us to treat this 4-centimeter mass in the right lower lung that's PET scan positive. He's fully functional. He just was hit by a car, by the way. He got waylaid for a month or 2 with a collapsed lung and broken ribs, but he's on the mend, doing well. The cancer we treated is in remission, and he wants us to go ahead, which we are going to do, make the stereotactic frame that's custom made and direct those beams to hit the cancer. And in the news department, the FDA reported that it's going to allow the use of a new drug. Merck is selling it under the name of Keytruda. It's for people with advanced melanoma, and it's to boost the immune system. It's one of the drugs known as a PD-1 or programmed death receptor 1. Now, I had a patient with cervix cancer that wanted to get on the protocol, and I called the people who were using it for cervix, lung, and other cancers, and they said that about 30-40% of the patients have a response, so it means the majority don't have a response, and it lasts, in this study, it lasted, only 24% of the patients actually, it shrank the cancer, and the response lasted from 1.4 to 8.5 months. So the phase 1 trial was with 175 people, 24% response rate lasting 1 to 8 months. And what's setting people off is it's going to cost $150,000 a year. Now, it's not to cure the patient. It's only working in 24% of patients and only for months, 1 to 8 months. So the article is in the New York Times this week. You can look up yourself, Andrew Pollack. It's a new drug. I know a lot of people always look for new drugs. We, by the way, do treat melanoma. We treat a lot of skin cancers. We treat melanoma, basal cell, squamous cell, Merkel cell with a very high success rate. Our success rate for skin cancers, including melanoma, anywhere in the body, the brain, the lung, the bone, the spleen, the kidney, it's about 90+%, and that's for the rest of the life of the patient. So we have a lot of excellent data. Also, if you have melanoma, this information may be of interest for those who are seeking a new type and a new mechanism of chemotherapy. So it was in, again, this week's Times. And finally, we had a patient. It finally means we're just about at the halftime of our football show here, if it was a football show. We had a man with colon cancer. Now, he came to us as a 56-year-old man. He's a crane operator. He's divorced. He has a girlfriend and a daughter. When he came to us, he came last January, and he had a cancer in the rectum. This is a man that had rectal bleeding for 3 years, and his doctors and others told him it was nothing. It was hemorrhoids without looking inside. So no one looked inside. They just said it was hemorrhoids, which is really sad. So it gave the cancer a 3-year head start. Anyway, he was eventually found to have a rectal cancer, and by that time it had spread to the liver. He had had extensive years of chemo, surgery for this cancer, and finally he was just tired of the chemo and tired of the surgery. And when he came to us, he had 2 nodules in the pelvis, and he had another nodule of cancer in the groin. So 3 nodules. We treated him with radiosurgery. We actually did all the spots quickly, so he had everything done. We did kind of 2 for 1. And this was January. It's now September, and he's in complete remission. He just had a PET scan on Friday. We like to get the PET scan. The patient has copies in their hands. They come to us. They get the report, the images, the report, everything. They speak to the radiologist the same day, so they know exactly what's going on. So he came in with his daughter. He's newly married. That girlfriend he had in January, he's now married to her. He's happy. He's working. He's with his daughter. He's healthy. Those 3 nodules of cancer gone away. They're in remission, and no new cancers. So it's fantastic news for him. We wish him well and wish him a great, happy life with his wife. We'll be right back, so give us a call at 800-321-0710. And here's a word from our sponsor.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212-CHOICES. 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
WOR New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back, and we're just talking about skin cancers. And interestingly, there's a new article out just this week that appeared in the LA Times that looked at melanoma risk. Melanoma is the most severe form of skin cancer, the one that's more likely to spread and take one's life. It looked at melanoma in airline workers, pilots, and cabin crews, and they actually found a double rate of melanoma in pilots of jet airliners. This is an article by Karen Kaplan in the LA Times this week, and she starts saying, "Attention pilots and flight attendants. For your safety, fasten your seat belts And be sure to apply plenty